Hi, this is Dr. Eric Westman with Adapt Your Life, and I'd like to talk about diabetes management when you're staying in place or in social distancing or isolation. Some areas are in quarantine now, and I, of course, wish you all the best during this difficult time. You can think about diabetes management under difficult circumstances, like when you have a sick day. The traditional teaching is to lower the amount of medication you take. If you're taking insulin, for example, and you're not eating as much, you would lower the insulin. That's called a sick day. But there are some things that are happening that I didn't really anticipate. I am now going to pretty much telephone calls, and I'm talking to people at home. And what's happening is when people are staying at home, they're eating differently. So there's not as much restaurant eating, not as much fast food eating. You're probably eating less, unless you have stress eating from the difficult time. You're probably eating less. And that means you have to be careful with the medications, because the medicines are adjusted to what you eat. And remember, because diabetes medicines are used to lower the blood sugar, if the blood sugar is too low, then you're taking too much medicine. You see, the blood sugar won't go too low if you're not taking medicines. Now, you may not have been told that, or you've been on medication so long that you don't remember that, but it's not normal to have a low blood sugar. It's the medicines that cause it. So I'm noticing now, as I go to phone appointments, can't use the clinic, that people are telling me that their blood sugars are going down. And so, because they're my patients in my program, I've taught them to check regularly, and of course be very careful if the blood sugar goes down to let me know, and then we reduce the medicines. Well, because diabetes medicines are adjusted to the food that you eat, if you change the food you eat, you have to logically change the medications. But it may not make sense, because the traditional teaching is to just eat more, or to have some sugar, or have some juice, something like that. But there are really two ways to address a low blood sugar or hypoglycemia. That is, eat some carbs, or maybe even just eat more carbs over the course of the day, if not just to rescue that at that moment. But there's another way to address the blood sugars going down, and frequently, or even a few times, and that is to reduce the medication. Remember, the diabetes medicine makes the blood sugar go down, so you need less medicine, and the blood sugar won't go down so much. Does that make sense? So I prefer, if you're on a keto diet, if you're on a program, especially where you're supervised and you're changing your lifestyle, or even after weight loss surgery or other medication programs, if your blood sugars are going down, I prefer that you reduce the medication rather than to just eat more carbs. It goes against the traditional teaching, but you see, my approach is that I want to get my patients who have type 2 diabetes to come off all of the medicines, lose the weight, which is causing the diabetes, and then you don't even have diabetes anymore. So if that intrigues you, if you didn't know you might not have to have diabetes forever, watch some of my other videos where I go into detail that not everyone has to have diabetes. So you can actually cure diabetes. That's type 2 diabetes, not type 1. Although if type 1s do this kind of program, they need much less insulin. So if you're having low blood sugars, call your doctor and ask them how to reduce the medication, because you're on too much medicines. Think carefully about whether you've been changing the way you eat while you're staying at home. Are you eating fewer carbs? Then you need fewer medications, because the carbs raise the blood sugar, which means you need more medicine to lower the blood sugar. If you choose to do a keto diet now, a low-carb diet, you have the ability to do that. There are a lot of free resources, including at Adapt Your Life, at dietdoctor.com. So take advantage of those things if you can. Otherwise, stay safe. And if your blood sugars are not being controlled, especially going too low, please consult with your doctor. I'm Dr. Eric Westman. Until the next time.